Welcome back to my channel. If you are new here, my name is Sydney and I play college basketball, and I like to talk about what God has done in my life in hopes that it will encourage you in some way. Give this video a thumbs up and hit the red subscribe button down below so you don't miss one of my videos. I've had a lot of questions about my recent hip surgery, so I just wanted to answer some of the more common questions on here. I had surgery on my left hip January 2020 to repair a break in my femur. Originally around August 2019, it began as a stress fracture. I continued to play through it unknowingly until it began to hurt a lot worse, obviously. At the end of October, beginning of November 2019, it was really hard to sleep and walk, stuff like that. Whenever I would run, I really had this sick feeling in my stomach like I was gonna throw up. My first MRI was horrific. You could see the fracture on my x-ray. Thankfully, I stopped playing when I did. I don't know how much longer I could have gone, if I'm being honest. She said if I would have kept playing or even taken a wrong step, then my femur could have just broken all the way across, like what Kevin Ware did to his lower leg, if you're familiar with the Louisville basketball player. Then I would have had to have a whole hip replacement at the age of 22. And I was non-weight bearing for about 3 months to let it heal as much as possible. It didn't heal as much as my doctor would have liked for it to heal, so we proceeded with surgery January 24th, which was about 10 weeks ago. To repair the break, my doctor used 3 screws to close the gap in my bone. I will not get these screws out. They will be in my leg forever. Fixing my femur was the highest priority, but my doctor was also able to repair my labrum, which was torn. Your labrum is the white cartilage between your femoral head and your hip socket. It acts as a cushion. Thankfully, my labrum wasn't super frayed, so she didn't have to cut a lot of it off. However, my doctor said it was the angriest, most irritated labrum she had ever seen. It had probably been torn for a while. So instead of it being white is what it should have been, it was really bloody. It resembled a piece of raw meat. I used 4 sutures to anchor my labrum to the bone. I had a big bone spur on the head of my femur, which is what probably caused my labrum to initially tear. I also had clusters of bone spurs also on my femur. She just completely shaved the head of my femur so it would be smooth. I also tore I don't know if I'm saying this right, but it's like ligamentaries. It's apparently a ligament that a lot of athletes tear. So my doctor also fixed that. Overall, it was a very extensive surgery, but my doctor said everything went as well as what it could have, and she's been really pleased with the progress I've made so far. Besides being really raw and sore a couple weeks after surgery, it really wasn't as painful as what I thought it was gonna be. My quad just kind of felt like one big bruise. I was very tight and sore in my groin, hip flexor, IT band, adductor, and glute muscle. I got off crutches after 5 weeks, and it was really hard to walk at first because my glute had a lot of trouble firing. But my doctor said that was normal, that she wasn't that concerned because she had to cut a portion of my IT band in order to drill the screws into my femur. So it was gonna take a while for my glute to start firing again. Around the 6th week mark, I started developing some hip flexor tendonitis, so I had to chill on my physical therapy exercises for about 2 weeks and let it cool down. And I feel so much better now. Granted, all I've been doing is walking my dog, going up and down the stairs. I have been able to swim a little bit and just do the basic PT movements, clamshells, glute bridges, things like that. Like any surgery, be slowly increasing my physical activity, being careful not to overdo it. And my doctor is confident that I will make a full recovery, so I'm confident too. As an athlete, I do think it is so important to find the balance between working hard and overworking, because obviously you have to work hard at anything you do in life, like that should go unsaid. But I know how easy it is to overwork your body and your mind. As an athlete, if you want to optimize your performance, you have to be at the appropriate stress level. And I'm gonna enter in a little graph here that I found on the internet. You just want to be in the appropriate stress level range. You don't want to be on one side or the other if you want to perform optimally. For me, I've always been the perfectionist, obsessive, black and white thinking athlete. So if one thing is good for me, then a lot more of it has got to be better. If I went a day without working out, I would feel so guilty. I would just feel like I was gonna get worse as an athlete and as a basketball player. Like, you know, I would lose like all my skills overnight or something like that. I had this motto, can't even believe I'm saying this out loud. It was ibuprofen equals I be playing. I definitely wasn't listening to my body. Not when it came to when I was hungry or when it was telling me it needed rest. So it's very important to prioritize rest, recovery, making sure you're properly fueling your body with nutrients and the calories that it needs in order to produce. And again, it is so important to develop your craft, but more is not always better. Obviously, being lazy is not going to get you anywhere. Obsession will get you somewhere, but I can guarantee you that it is not where you want to be. Some of us have just got to be honest with ourselves. Like I said, it's a fine line because some of y'all really need to be doing something. You know who you are. And others of y'all are doing the most. You're going to be negatively affected. If you're someone like me, you have permission to listen to your body. I really hope you can learn it from me. You can take my advice and not have to go through an eating disorder and a broken hip or something like that if you don't have to. That just ain't it. Obviously, if we're athletes and we want our bodies to perform at their highest level, then we have to be taking care of them. We have to be letting them heal. Too much of a good thing is not a good thing. I think that's everything. That's everything I can think of. I just wanted to give you guys a really quick update on my hip because I've had a lot of questions. Thank you for watching. If you have not already, please give this video a thumbs up and subscribe. I will see you in my next video.